Welcome to today's episode of Aspire Taught You. I am looking at the camera at you. All right, so today I want to talk a little bit about a subluxation. A subluxation is the center, I would say the cornerstone of chiropractic in regards to things, the main thing that we treat. What is a subluxation? A subluxation is a misalignment or dysfunction of one or more vertebrae. I know that doesn't make a lot of sense to you, but it will. So what can that call? What can a misaligned vertebrae cause? First of all, here's a misaligned vertebrae. Let's say this is T3, that's your mid-back. This is T4, this is T5. T4 is subluxated. It's stuck in that position. These are correctly aligned. This is incorrectly aligned. What does this cause? This basically causes your nervous system to not be able to communicate effectively. Your nervous system basically controls everything. It controls your muscles, it controls your organ function, which can intervene and cause a variety of symptoms if you have a subluxation or multiple subluxations. Multiple effects that can occur from a subluxation. Obviously, pain and stiffness. That's the most common reason people come in. People come in, oh, my neck hurts. Oh, my back hurts, doc. Walking in like they can barely walk. That's the most common thing that we see when people have a subluxation that needs to be corrected. Obviously, people are going to have a reduced range of motion. And we can test range of motion and find a subluxation just off of testing range of motion and obviously patient pain tolerance we feel for it. So, say a patient bending backwards, right? That's a normal curve. Let's say they have subluxation in their low back or one or two of them. They can now extend that far back. Their range of motion is altered due to a subluxation. That could mean we have vertebrae here in the low back. This one right here could be shifted down. Why is that causing decreased range of motion? Because if it's out of line, it's now hitting the other vertebrae and it can't move anymore. Therefore, the patient cannot extend back as far. We correct that with chiropractic adjustments. This can lead to muscle spasms or weakness of muscles. So here's your spine right here, your low back spine, your lumbar spine, your low back to you. We have muscles right here on the outside protecting the spine. We have muscles everywhere that protect the spine. If there's a subluxation, let's say this is shifted or turned that way, it's going to aggravate these muscles. These muscles are not used to that. It's not in the right spot. They're going to react accordingly, which is going to cause spasms of the muscle primarily. All right, headaches or migraines, same concept up top. You got a neck right here. Vertebrae in your neck. If one is misaligned, let's say this one is rotated to the right, what's that going to cause? A subluxation. This is going to lead to it wrapping around the pain, your head, causing a headache. All right, it's tingling and numbness in the arms and legs. This is another form of what you could call sciatica. This is something you can relate sciatica to. I feel like it relates to everything that we talk about. So nerves come out of the holes of these vertebrae. Let's say these are the holes right here. Give you a different color so you can see. Let's say these are the holes. Nerves come out of these. Boom, boom. This is your arm going down. If this nerve comes out of this hole, what's going to happen if this vertebrae is not where it's supposed to be and it's rotated this way? It's going to pinch those nerves or put pressure on those nerves. That's going to squeeze them, and it's going to cause this numbness and tingling going all the way down the arm or the leg. Same exact thing if it happens in the low back. Also, less common. A subluxation can lead to digestion, proper breathing patterns, and other bodily functions involved. We fix subluxations with chiropractic adjustments, the #1 tool to fix a subluxation and correct it. Pills and needles do not move bones. They're not going to fix subluxations. So what this is going to do, this is going to take pressure off of these nerves. When we correct this, if it's shifted to the right, we now adjust it with our hands. Boom. It's going to go back to the left, and it's going to be realigned center where it's supposed to be. What's going to happen to this nerve? No more pressure on the nerve, no more numbness and tingling, right? It's going to reduce pain and inflammation back to the muscles. So we have our spine. We have our muscles that surround the spine. It was shifted to the left. It was shifted to the left. I make an adjustment. Boom. It goes back to the right. But it goes to the right from the left, but now it is aligned, right? It's no longer irritating that muscle. That muscle now has relief. Range of motion. We correct the misalignment here. It's now going to allow for full range of motion and mobility in the low back, or vice versa, wherever, the mid back, the neck. We talked about the low back earlier. It's going to improve range of motion. All in all, it's going to enhance communication and overall health. So communication to your nervous system. Your nervous system doesn't detect a subluxation, then none of these symptoms are going to happen. You're going to flow properly. So that is a little bit about what a subluxation is, what it causes, how we treat it. You know how we treat it. We make adjustments. That's why you come to our office. And some signs and symptoms that are associated. So we want to see you. We want to get you better. We want to see you less. So come back to the next episode.